Afternoon, everyone. My name is Dr. Maya Price, and we are super excited to have this conversation with you this afternoon. If you have come to this session that is really centered around hunger, nutrition, and health, through the power of powerful collaborations, you are definitely in the right place. When we think about this conversation today, it is very, very important to really center us in the power of collaboration. And what does that mean, especially in today's time? Today, you are going to hear from so many phenomenal panelists and their perspectives that come from so many different cross-sector opportunities in cross-sector organizations today. So with further ado, I do want to kick off our panelists, but I will be also opening up for them to share some of their own remarks. But before I do so, I first want to start with our first panelist for today, who is going to be Casey Aden-Wansbury, who is the VP of Policy and Government Affairs with Instacart. Casey has done so much in really helping the company grow its policies team and also really deepening relationships and collaborations with so many key policymakers at the federal, state, and local level. So thank you, Casey, and I'll turn it over to you here briefly. The second panelist we'll also have for today is going to be Sakeenah Shabazz, who is serving as a senior policy advisor with the Biden-Harris administration, who plays a very, very critical role as it relates to movement with USDA, Food Nutrition Service. So thank you, Sakeenah, for also being here with us today. The third panelist we're going to hear from today is Uche Akobundu, who is the Director of Project Management and Impact at Meals on Wheels, who has so much experience when it comes to community building around nutrition and also really ensuring that services are provided to so many individuals across the U.S., especially as we think about research and evaluation. So welcome. And then lastly, but also not least, we are also going to hear from Sabine Delouche, who is the Community Impact Director at the American Heart Association, who has done a lot, especially when it comes to healthcare promotion and movement. So before I turn it over for them to provide some opening remarks, I do want to say again that this conversation is super powerful today. I hope that you'll be able to walk away with so much incredible insights that you will be able to pass along to so many of your networks across this nation, because this conversation is critical and it is definitely needed as we are making impact for not only today, but as we are moving into the future. So without further ado, I would love for Sakeenah to get us kicked off with your opening remarks. And I really want you, Sakeenah, and everyone on today's panel to really center us in how does the work of your organization and company really connect to today's theme? And how are you working in this space to really drive momentum and drive impact, especially as it relates to where we are now, and also any commitments as it relates to the White House initiative? So, Sakeenah, I'll turn it over to you.
Thank you, Dr. Price. It's really wonderful to be here. Also, thank you to the Alliance to End Hunger for hosting this summit and for extending invitation to the USDA Food and Nutrition Service. I know many of you also got to hear from Deputy Undersecretary Cindy Long earlier. That is my boss. I'm so happy that we were able to be here and represent on so many different fronts for this very, very important gathering, and then also for this wonderful plenary session. And so I'm just going to get us kicked off a little bit more about myself. I'm at the USDA Food and Nutrition Service. I serve as a senior policy advisor, and my portfolio includes the historic White House Conference on Hunger, Nutrition, and Health and the corresponding national strategy. I also have the opportunity to work on F&S programs and policies in U.S. territories, interagency collaboration as it relates to veterans, people experiencing homelessness, and youth aging out of foster care, and also some of which I'll get to talk a little bit more about later, our local and regional food systems portfolio, which includes awesome programs like farm to school, and other efforts that have come out of the agency to support local purchasing for schools and other institutions and supporting our local and regional food systems. I think a lot of folks who are here today are pretty familiar with the U.S. Department of Agriculture and also with the Food and Nutrition Service, but just to give a little bit of a refresher, we are an agency under the USDA, the USDA, and our mission area is Food, Nutrition, and Consumer Services, and we're the only agency under that particular mission area at the USDA. And our primary focus is to get direct food assistance out to folks across the country, whether we're talking about school meals, the SNAP program, the WIC program, and so many other efforts that help Americans put food on the table or get food into our schools and help people have more full and healthful lives by supporting food access and direct food assistance. We operate 16 federal nutrition programs at the USDA Food and Nutrition Service. Our most recent program to have permanent authorization is summer EBT, which we are so excited about and getting geared up to prepare for summer 2025 as well. Our programs reach 1 in 4 Americans across the age spectrum and are just one of the most far-reaching tools that we have in our toolbox to combat food insecurity, hunger, and to support access to healthy, nutritious food across the country. The White House conference that took place in September 2022 was groundbreaking, and I'm sure many folks on this call were also there and participating in that. And the corresponding national strategy has really been a compass for a lot of the work that's happened under the Biden-Harris administration across different departments and agencies, and also at the community level and at the state level with different organizations that have made commitments coming out of that conference. This is a whole of society and a whole of government approach to advancing food and nutrition security, and FNS is one part of that picture. And some of the ways that the agency that we thought about the operationalizing our work coming out of the White House conference, a lot of this is already built into what we do at the Food and Nutrition Service. It's already built into the 16 programs that we administer across the country and at the state level. But the sort of 5 buckets that really are applicable to what we developed at the Food and Nutrition Service includes meaningful support, access to healthy food, centering equitable systems, and also advancing research around nutrition science that really informs our programs. The collaborative action and partnership work that's come out of that, I think, is really going to be the center of our talk today, and is part of why we are gathered here today for this particular plenary session and for the summit. And across this work at the Food and Nutrition Service, this has included work with healthcare partners, state agencies, different interest groups and associations that work with schools, that work with states, that work with different issue areas, nonprofit organizations, and so many more to improve policies and systems so that we can advance nutrition security over the course of doing this work, and also using the latest nutrition science and research to support the programs that we administer to make them stronger, and to also make sure that we are doing so with evidence that supports the work that we want to do and is backed by science. And FNS has executed on so many accomplishments in the last 2 years as it relates to the White House conference. And I just on 2 of the pillars. Pillar 1, which is improving food access, and then also Pillar 2, which is integrating nutrition and health. I'll just go through a couple of things before handing it back over. But under Pillar 1, when we think about improving access and affordability of food, the first thing that really comes to mind is our work around summer EBT, moving that from the pilot stage over the course of a decade and getting that to permanent authorization as a program that will be stood up and operating for years to come is so huge. We are so grateful for our partnerships with the states that are operating the program and have so much technical assistance and support available to continue doing that. We're also talking about the development of and finally piloting online shopping for SNAP. Instacart, who's here with us today, specifically Casey, has been such a huge partner in our ability to be able to get that work across the finish line, and is also a groundswell of work that came from the community level and from the state level because they wanted to see that happen at the USDA Food and Nutrition Service. We're also talking about the expansion of the community eligibility provision, which means that more young people are eating meals in schools, and schools are also being supported with more reimbursement to be able to do that, and enhancements to WIC and the WIC food package, which a big hallmark of that too was increased access to more fresh fruits and vegetables. We've been hearing that from WIC participants, and also foods that are more culturally relevant and specific to the foods that different participants in the program want to have. And then related to pillar 2 on integrating nutrition and health, so much work has happened in this space, and we are really, really proud of our partnership, especially with the Root Cause Coalition and with ProMedica coming out of the conference 2 years ago. FNS hosted a conference called Come to the Table, and it was a National Nutrition Security and Healthcare Summit. And from there, we kicked off 7 regional summits in partnership with Root Cause Coalition and ProMedica to bring this knowledge and gathering and work with partners across the country. And as we are coming to the close of this administration, we are actively thinking about ways to stay connected and to ground this work in a way that can be felt and can continue to reflect the positive work that's come out of that. An important part of this work as well is collaborating with our interagency colleagues, especially at the Department of Health and Human Services and the Veterans Health Administration, when we're thinking about our food as medicine work and really maximizing interagency collaboration and really creating a solid foundation for what we mean when we talk about food as medicine and how that work can be integrated back into our programs as well. And then also our work on My Plate is so important. It's the symbol for healthy eating. We have the opportunity to engage with partners across the country and to do public education and policy engagements. And I always ask the crowd, are folks familiar with the food pyramid? Are they familiar with My Plate? And My Plate has been around for a really long time, but there's still a really important public education must continue from there. And our My Plate National Strategic Partnership, which is led by Dr. Kari Cotright, who is our Director of Nutrition Security, is really at the front of a lot of our work to integrate health and nutrition and to make sure that we are reaching folks who can participate in these programs, who can uplift the symbolism and importance of healthy eating, and just making sure that we're being as resourceful and connected as we can be. With that, I'll wrap it up to pass it over to my other co-panelists, but it really is an honor to be here today, and I look forward to the rest of the questions that we'll have for our time on the plenary. Thank you.
You're muted, my friend.
Sakeenah, I think that you definitely hit it on the nail when you talked about the power of partnership and how we can't do this alone. And so with that being said, I do want to turn it over to you, Casey.
Great. Thank you so much, Dr. Price. I'm thrilled to be here with you today and thrilled to be here alongside all my fellow panelists. Have so much respect for all of your organizations we've either have or in the process of working or finding ways to collaborate with each of you. So I'm excited about all of that. But I'll start by just saying, again, I'm Casey Aden-Wansbury. I'm the Vice President of Policy and Government Affairs at Instacart, where I also oversee our social impact work. And we're just really honored to be part of this discussion as a private sector partner. For those of you who are not familiar with Instacart, we're the leading grocery technology company in North America, and we partner with 1,500 different retailers to reach more than 98% of US households. And that includes 93% of food deserts. So we do have a pretty wide reach that we're able to bring to the table in terms of attacking these problems. And that means every day, millions of families turn to Instacart to access the food they need from local retailers that they trust. And that local retailer piece is important to us. Over the last decade, since we've been around, we've always been really at the intersection of food and people, and as a result, nutrition and health. But we recognized that we had an opportunity to do even more to help people access nutritious food that they need. So in 2022, at the White House Conference on Hunger, Nutrition, and Health, we launched Instacart Health, which is a new initiative using our products, our platform, partnerships, and policy advocacy all together to help deliver healthier outcomes. Since launching, we've been able to offer Instacart Health technology to help partners in the public and private sectors, as well as nonprofits, university researchers, and others, really reimagine what's possible when it comes to food access and nutrition programs and how they work. So I'll just touch on a couple of these projects, and we can certainly talk about more as we go in the discussion. But first, as Sakeenah mentioned, we've been working with the USDA and with FNS for quite some time to expand online SNAP acceptance via the Instacart platform to now 30,000 stores across all 50 states and the District of Columbia. That is really, we're the first to do that, and we're really proud of that. And we, we're really seeing results in terms of being able to help give people more ways to access their SNAP nutrition benefits. Also really excited that Sakeenah talked about EBT SNAP, summer EBT, and we're excited about summer EBT as well. And then the second project, just to mention, is a collaboration with a nonprofit with Partnership for Healthier America. As part of the White House conference, we committed to bring 10 million servings of produce to nutrition insecure families across the U.S. by 2025. And we've done this in collaboration with PHA through some pilots in a number of cities. And today, at this point, we've delivered significantly more than half of those servings. For that program, we use a technology that we call Fresh Funds, which is essentially our virtual grocery stipend, and it can be restricted to certain items like produce in the case of this pilot. So we're excited about the possibility of what these types of technologies, the payment technology that we're able to use with SNAP and stipend technology with Fresh Funds, are just two examples of the ways in which we're able to help bring new tools to the table to this conversation. So, I will say partnering with nonprofits, with government, with others is really a key part of this. We can't do any of this alone. We have a lot more partnerships in the works. We're working with health plans, with healthcare systems to integrate nutrition using these tools. We're working to try and make healthier choices easier for consumers by making expert nutrition advice shoppable for people managing diet-related and chronic conditions. And we're looking forward to launching more nutrition security partnerships for underserved communities with a variety of partners, healthcare, government, nonprofits, and others. So pretty wide variety of projects. And we're really just excited to be at this table and be part of this discussion, and looking forward to working with all of you in the room. So I'll turn it back over to Dr. Price.
All righty. We will pass it over to Uche.
Great. Such a pleasure to be here. Thank you for the opportunity to connect. My name is Uche Akobundu, and I serve as the Senior Director at Meals on Wheels America, where I lead the design and execution of our national nutrition strategy. This work includes the oversight of varied national and deep community-based programmatic initiatives that are really designed to help build the capacity of the Senior Nutrition Network to provide evidence-based and client-responsive meal and nutrition services. Ultimately, we seek to collaborate with corporate partners, such as folks around the table here today, as well as national and local strategic partners, again, to build that knowledge and skills of our nutrition service providers at the community level. I'm so pleased to be on today's panel to represent the interests of our senior neighbors, our senior family and community members through Meals on Wheels America. And in case some of you are not familiar with Meals on Wheels America, it's a national leadership organization that supports the over 5,000 community-based programs across the country that are dedicated to the daily delivery and support to address senior isolation and hunger. We're powered by an amazing, trusted volunteer network of partners locally that provide a comprehensive solution that begins with the meal and also seeks to support independence and well-being through additional evidence and opportunities through tailored nutrition, social connection, safety, and more. So together with this amazing network of volunteer workforce providers, we're able to serve 2 million older adults, over 250 million meals that largely support their health, wellness, medical, cultural, and personal preferences. So partnership and collaboration, just as my co-presenters have mentioned, are really essential to the work that we do here at Meals on Wheels America and to our local programs on the ground in order for them to successfully serve the communities that they support. And so collaborating allows them and us to really meet the needs of older adults in new and effective and exciting ways. One example in the nutrition space is a multifaceted partnership with DoorDash, who's a sponsor of today's summit. So through Project Dash, Meals on Wheels programs have access to a powerful solution to help break down barriers to food access and ensure cost-effective and convenient delivery alternatives in times and in spaces and places where typical delivery methods aren't possible, either due to volunteer shortages, weather, or other constraints. In addition, Meals on Wheels America has partnered with Food Lion Feeds to meet the range of nutritional needs for older adults, including the provision of medically tailored meals. Through this partnership, we're so excited to be able to offer Food Lion employees as well the opportunity to forge relationships locally and support these local programs in deep and interesting and novel ways. And some of this have included stores adopting local programs and helping support meal delivery. But among some of the more powerful collaborations that we advance is really our partnership with our members to identify and test innovative practices for replication and scale across our national network. These local programs are experts in the provision of nutritional support. And in recent years, we've launched a series of collaboration grants to really foster strategic partnerships between local programs, allowing them to extend their reach and impact to really meet the growing need and the evolving needs and wants of the older adult population. So this helps us surface new, interesting, innovative ideas at the local level that are ripe for replication and continued investment. However, despite these tireless efforts of local programs, we do know that a lot of older adults across the country are waiting. Across the nation, nearly 13 million seniors face food insecurity, and 30% or so are feeling lonely, a declared epidemic. They're waiting for nutritious meals, moments of connection, and for caring and support from their communities. So we're so excited to have launched recently a national strategic plan called End the Wait to ensure that everyone who needs Meals on Wheels gets it. As part of this plan, we aim to transform how our organization, our network, and our country work together to champion older adult well-being. We're advancing this mission to help really serve older adults, more of them, and serve them better, to make sure they have access to services that meet their evolving nutrition, social connection, health, and wellness needs, so they can live that nourished life with dignity and independence in their communities of choice. With regards to the White House Conference, I'm so pleased to be able to participate in this whole of government, whole of society initiative that centers nutrition and focuses on the power of collective action to improve health. Our commitments have centered on really amplifying the older adult voice, making sure that they're not just on the menu, if you will, but at the table, being able to make decisions. So we continue to partner with entities such as many of you listening today to advocate for legislation and policies that really support the improved health and well-being of older adults. We raise awareness through the public, through campaigns such as our Save Lunch or Respect Your Elders campaign. And of course, our End the Wait initiative will allow us to collectively serve the older adult community, improve their health and well-being through innovative practice, thought leadership, strategic alliance, and policy advancement. So we're so excited at the opportunity to speak about these collaborations today, and we'll love to turn things over to my next co-presenter.
All righty. Thank you so much. And Sabine, we'll turn it over to you.
All right, thank you. So hello, everyone. My name is Sabine Delouche, and I am Community Impact Director for the American Heart Association in South Florida. So I really oversee our work in Miami-Dade and Broward counties, two of our large urban counties in Florida, and really bringing the work of the AHA to the local level. And as an organization, kind of how we play in this space, AHA has always had a commitment to the food and nutrition space. Our mission, if you read our mission statement, it's to be a relentless force for a world of longer and healthier lives. We always talk about how we don't necessarily specifically say heart disease in the mission statement because there's so many different factors. And so for us, it's really important to look at a multidisciplinary and multi-factor approach of addressing heart disease, which is the leading cause of death in the US. And so for us, we've been in the space of nutrition education. We've been in the space of policy as well. People may recognize the heart check kind of symbol when you're at the grocery store that shows, okay, maybe this product is a little bit healthier than others. But something that's really been kind of ongoing and what we're at the forefront of right now, which actually a couple of people have touched on, is the work around food is medicine. So going beyond, just education, and really now let's take a look at What can we be doing at the systems level, really taking a look at behavior and how do we impact health in a way that we're addressing barriers really to health access and health equity. And so in 2023, AHA did release a presidential advisory on food as medicine, really looking at it as a key strategy for improving health outcomes for millions of patients. And this was important, and I think especially highlighted throughout the pandemic, the need to address these barriers at the root cause. And a big thing is, how do we bridge the gap between the work that we're doing in the community space and what we're doing within the clinical space, so that we can have the largest reach and the largest impact. And so through Food as Medicine, we're really looking at research, advocacy, education, as well as quality improvement. And so one of our most exciting initiatives, our kind of Food as Medicine initiative, is called Healthcare by Food. So we're currently in a space where we have invested in 20 research projects at the core elements of food as medicine. We know that there are elements that work, but we really want to understand, how can we standardize what's happening in this space? How can we create something that's cost effective? And what's going to be the best way to either bring in appropriations or bring in, get health insurance companies involved in this space. And so the research projects really are taking a look at medically tailored meals, medically tailored groceries, and also those healthy food and prescription programs. And so it's been a very big thing for us at the national and local level to, again, bridge that gap between what's happening within the community and within our clinics. Something to kind of highlight of, how do we play now at the local level? An example for me down here in Miami is we recently launched a collaborative. And so we're talking all about collaboration. We recognized that there was a need, kind of everyone was working in individual silos, and we didn't really have a county-wide way of addressing hunger and addressing nutrition security. So AHA, along with 6 other core organizations, formed Food and Nutrition for All, which really is a collaborative in which we're working to establish a formal plan for Miami-Dade and for moving forward. We're in a space, especially where we're kind of in housing crisis, economic crisis, and recognizing that people are really having to make a decision of, well, can I purchase enough, groceries and food for me and my family, or am I able to pay for rent or for my mortgage? And so it's great that we were able to bring in nonprofit sectors. We've brought in grocers, farmers, but one of the big things for us was being able to get the backing of the mayor as well. And so our local mayor, Daniela Levine Cava, and her office have been there at the table with us for every meeting, and really trying to establish this formal collaborative. And so where we are today is that we are working on our health equity and hunger relief plan. To identify, the big thing is really creating a structure where we have goals and outcomes that we're working towards. We've seen success in other markets and other counties. One of those is just north of us in Palm Beach County, where they've been able to really measure. And that's one of our big things, especially as a science-based organization. We want to understand kind of what's working, what's not. And so creating clear goals to tackle hunger in our community, and what are going to be those measurable outcomes that we're looking at. And we're grateful to have project management currently through Delouche to be able to create that clear mission and vision statement moving forward. And then just finally, kind of, again, our big focus is creating long-term and sustainable impact. And so that's like the key role that I do as a community impact director. So I enjoy getting a chance to be able to work with schools, faith-based organizations, large corporations, hospital systems, on some of our key nutrition initiatives, which do include screening and referral. So really identifying who are those food insecure residents in our community, and how do we ensure that we're screening and referring them to appropriate resources, and then working to increase access to health and foods, healthy foods, whether that's through pantries, whether that's through appropriations, nutrition policies and guidelines. So there's a number of great things that we're doing in this space, and I'm excited to just be able to share more. And thank you for having us today.
Absolutely. And just one thing I do want to say before we move into a series of questions, as you all heard in the opening remarks, so much collaboration and movement that is happening. And I am going to turn our first kind of question over to you, Casey, and would love to hear about what kind of collaborations really make this work possible. And what do folks looking to engage around collaboration need to know, especially coming from Instacart and the work that you're helping to lead?
Sure. Thank you for the question. And great to hear about all of the exciting work that all of my fellow panelists are doing. In terms of what makes this work possible, I mean, I think the first sort of probably obvious thing would be, are the types of partnerships and the natures of partnerships that we've been working on run the gamut. There's a huge variety, but they do all share the same basic vision, which is that we're looking to, use innovation and technology to help expand food access and improve nutrition. So that's sort of the common thread among the partnerships that we work with. I think, other than that, it can really vary based on if it's a nonprofit and what their goals are versus universities versus healthcare systems versus local governments. And we really embrace it all. I think in terms of, working with us, the thing that we bring to the table that we think is pretty unique and exciting is our technology. So the role we can play best is really developing and deploying that technology to test and to iterate on the groundbreaking ideas that our partners have towards healthy outcomes for all. So, we bring the technology, but it really works. It works best, and it only works in collaboration with partnerships and leaders like the folks on this panel and in this room who deeply understand the needs of the communities that you serve and the everyday problems that you face. So, when we work with a partner, we strive to build a strong feedback loop with that partner to make sure that we're continuously improving our processes and our products and our services, making sure that the participants are able to use the systems and that things are smooth, and to make sure that our partners are able to get the information that's helpful for them in terms of understanding the outcomes of the program and the goals that they're trying to reach. So one quick example of this is our work with the USDA on SNAP, or is our work on SNAP broadly. Certainly, to sort of get that online, the entire ecosystem had to come together. We worked very closely with the USDA and with FNS in particular to really understand how to build the technology that would meet the needs of the program. And then we also had to work with all of our retailers. We have 1,500 across the country to really, individually to make sure that this worked for them and for their stores. So that, that collaboration with multiple partners and making sure that this sort of worked for all and that we had a tight feedback loop was really essential. And we take that spirit into each partnership that we enter into, regardless of the goal or the partner that we're working with. I think you're muted, Dr. Price.
Sakeenah, I'll turn the question over to you.
Thank you. This is a really great question. And when having time to reflect on this, I think one of the things that is really important on our side as a federal government institution is being able to also work with other federal government partners, whether it's an agency within the USDA or another federal department, such as the Department of Health and Human Services or the Veterans Affairs Department. And I think that's best captured through interagency collaboration and interdepartmental collaboration as well. I think sometimes government is known for being slow or maybe not necessarily being a little bit siloed sometimes. And so I think the work that we do around food and nutrition security really represents some of the best of interagency collaboration that can happen at the national and with the federal government. Sometimes that's captured through memorandums of understanding, memorandums of agreement, being on different working groups, and really making sure that we're putting our heads together to think best about the American people and to think best about how the resources that we have to be positive stewards of are going to reach the folks who they're intended to reach, and especially folks who are not being reached by our programs currently. And so I think that interagency piece is really important. On this, but public-private partnerships are also really important. We're pretty savvy at the federal government. We have a lot of resources to use, but we don't necessarily have that technology or capability to build something like that out ourselves. And so I think it's really important that we're able to partner with trusted messengers and folks who are also aligned mission-wise in terms of making sure that folks are getting access to the food and nutrition that they need. And then also, part of that is collaborating on conferences, panels, workshops, things of the nature like we're doing now. We also have a really robust infrastructure for working with universities, especially through agricultural extension, our SNAP Ed extension, things of that nature. And I think a lot of the partners that we have at the universities and with our land grant institutions in particular, they have that foot into the community. They have that door and port of entry into the folks who we want to reach and who are most proximate to the communities that they're serving. And that's really, really important for us. And then also the other kind of collaborations that make this work is thinking about our healthcare partners, thinking about our state agencies across the country that administer our programs from FNS, that are often, first in line to serve when a disaster happens or when there is a need for very direct food assistance. They are very proximate to that. And within the Food and Nutrition Service, we have 7 regional offices that serve all 50 states, the District of Columbia, and also our U.S. territories. And so they're really crucial for our planning purposes. And really also when we think about external engagements, policy engagements, we are relying heavily on our state and regional partners to make those things happen. And so those are some of the types of collaboration that come to mind when thinking about how we make this work happen and how we make it possible.
Great, and thank you. And Uche, I'll turn it over to you.
Thank you so much. It really is an excellent question. And I so appreciate about the opportunity to learn from my co-presenters as we draw out from our respective areas of research and engagement, the different flavors of partnership, because it's not one size fits all. There really are lots of levers to push and pull because the scale of what we're trying to accomplish in our respective areas and across our areas of interest is so large. So when I think about collaborations and the words that come to mind that really characterize this work, I keep thinking of words like right-sized, client-centered, evaluable, scalable. I mean, these are the things to make sure that at the end we're delivering on the needs of our constituents that we're here to serve. Right-sized collaborations are those that look at persistent pain points and really sort of leverage the operation to solve those and address the things that limit access to services that we know that people want. Client-centered collaborations are those that really are informed of the community. Again, so they are part of not only, we're not designing on their behalf intervention and collaboration, we're really having them have a seat at the table in the design, the deployment, the evaluation, ultimately the iteration of the collaboration to ultimately meet those needs. We want those collaborations to be thoughtfully designed to include make sure they're evaluable so that we can understand the outcomes on the back end and really leverage those learnings into greater support and access for the communities we're seeking to serve. Looking ahead, we know that, again, digging into that public-private partnership arena is really important, seeking out non-traditional corporate and business partners to really infuse capabilities where they're needed in the community area so that we can continue to provide access to meals that matter in different communities, particularly those that are underserved. For those seeking to build and leverage these kinds of collaborations, it's really important to engage partners, as many of my colleagues have mentioned, that have common values, that really desire to work smarter, who have a sense and a tolerance for risk and a sense of urgency. The work we're trying to do is great. There are many older adults in this country that are often hidden, often not thought of, not regarded. And so it's this work that it puts fire in our belly that really propels us to move forward, because we want individuals to be more secure, healthy, connected, so that we can have an inclusive future for all of us. So these are the ideas that I think of when I think about what's powerful, how do we structure collaboration, how do we make sure that we're successful at the end?
Absolutely. And Sabine, I'll toss it over to you.
So when I think of collaboration, A big word that came to mind for me was robust, and not necessarily in the quantity of how many people are involved, but really like the quality. And so having that range of perspectives, of expertise, and you want to have kind of that in the same space. Something that really stuck out to us is when we had our roundtable discussion, so a countywide roundtable discussion, people were sharing to be able to have large hospital systems and then community members who are patients be able to be in the same space, having those conversations together was huge. Or to have the farmers, local farmers in the same space as the national grocers and national supermarkets, to be at the same table and having that conversation so that we could understand kind of through the gamut of the food system, of from the beginning of farming to getting it to our table, kind of what are the barriers? What is it that we need to be working on? What are we kind of seeing? Again, we're all in our different spaces and working on kind of our goals. And we found that a lot of them align. So a lot of times people might be surprised to see alignment in what we're working towards. And so for us, that was huge. And when it comes to collaboration, I think asking others too, for us, we like to be a connector in the community, but I can't say that I know everyone. And so for me to ask, hey, who else should be here at this table? Who are we missing? That's one of the things we really do like to make sure that we're asking, because we want to have that wide range of perspectives and expertise at the table. And kind of as far as what works, and really if you're looking to engage in collaboration, what to know is it does take time, patience, and perseverance. Sometimes it can get frustrating, or you can reach that point where it feels like so many chefs in the kitchen. And so just really trying to navigate that can be one of those challenges at first. But when you do have someone who's kind of like leading the way, or one or two entities that are really taking the lead and inviting everyone to be in that space, and allowing everyone to voice and speak their opinions and their minds, we really have found that to be, just a very success at the local level and also nationally.
Absolutely, Sabine. And, this brings me, of course, I have so many questions for you all, but I know we don't have all the time in the world today. But this really brings me to the next question around future. And when we think about the future, it's so unbelievable how fast time, goes by. You look up, we're in a new month, we're in a new year. So, Casey, I do want to toss it back to you, and would love for you to just talk about what do you see as the future of this work, and how do we take things to the next level? And I feel like you touched on it a little bit in your previous response, but would love to hear a little bit more. How can we take things to the next level?
Yeah, I think, I think that we're certainly biased, but we're most excited about the rapid evolution of technology that we've seen in recent years, including AI, to think about, we feel like we're seeing a moment where the technology is ready to really meet the moment to help scale in good ways a lot of the work that a lot of advocates have been doing for a long time. And so we feel like it's a really, an important inflection point really at being able to use technology to really scale this work. So I think, for an example, I think, you could think about now the technology exists for people across the country, even in communities, including underserved populations, who suffer from, say, chronic health conditions, to be able to shop each week from a special grocery list that's designed specifically to help manage and treat those conditions. They can get, access to those things and have them delivered really easily. Or, pregnant mother that's living in a food desert, can't get to a grocery store, delivery of medically tailored foods through her clinical healthcare provider. Bringing all of those partners together to help get to get people exactly what they need when they need it in the most efficient way possible. Those technologies exist now, and I think we're really excited about how they can be applied. But none of this really reaches its full potential to improve people's lives without this entire ecosystem kind of working together, each part doing its piece. So I think we feel like it's a really important moment, but we do all, that collaboration really is what's necessary to get us to the next phase.
And especially as we're taking things to the next level and just also growing together. So thank you so much, Casey. I'll toss it to you, Sakeenah. When you think about just forward movement in the future of this work, talk a little bit about how we can really take things to the next level, especially given your perspective and just expertise from the federal level, and then also just all the programs that and initiatives that you outlined in your opening remarks.
Dr. Price. Going into the future, you can expect to see our programs still in action. They're programs that have permanent authorization through Congress. You will continue to see the SNAP program in action, WIC, school meals, and programs that are serving people across the country who are eligible for them and have a need to participate in them because of a lack of access to healthful food resources that that folks need to live good, full, healthful lives. You'll continue to see more partnership, especially with our regional offices across the country. They are proximate, they work in community, they work with our state agencies, and really represent our work at the ground level and across the country, while our national office is still executing on priorities and the mission of the agency. I think that there will continue to be more investment, especially in the food as medicine space, and more collaboration around that space. We are so thrilled with the work and investment that's come out from this, especially from healthcare partners and other partners on the ground that want to continue serving the community and who continue to invite us into that space as collaborators and as thought partners. And that's just, I think it's just incredibly exciting. I think outside of the space of our federal nutrition programs, I think that we're going to see more investment in community leadership as well. I think that there is always space to be cultivating the next generation of leaders, especially young folks or people who maybe have never had a seat at whatever policy or programmatic table or partnership table is happening. And that is always a good time to do that. I think we're also going to see more investment in folks who are maybe transitioning into their veteran status, who are leaving the military, people who are re-entering their communities and have paid their debts to their community or to the society that they belong to, who want to be involved in the food and nutrition space and who want access to robust, equitable economic opportunity to be able to take care of themselves and to be able to take care of their families. Our programs are here. We are proud of how we operate our programs, the reach of our programs, and think we can always be doing a better job in that space. But we know that food and nutrition insecurity has been a persistent issue across the United States. And I'd like to think that our work in this particular administration and within the Food and Nutrition Service under the leadership that we have has made a sizable dent in improving those conditions. But we know that this has been an issue for a really, really long time. And we know that we're not the only ones who can solve it. And so in the future, I want to see a bigger table. I want to see more voices at that table, more people who have not been represented before, more investment in mentorship and in people who are also going to make up our robust federal workforce as well. And so I just want to see more investment, more robust participation in our programs for those who need it, and continued thought partnership and collaboration on work that really, really matters, especially as we think about the ways that we've been impactful already. So those are the things that I think that might take us to the next level, especially as we think about the persistent presence of our programs and knowing that they'll go into the future.
Yeah, I don't know about you all, but I couldn't agree more. And Sakeenah, I have my running list over here too, so I feel like a lot of our ideas definitely match as we are thinking about just forward movement. And to your point, creating a bigger and even bigger table and really investing in individuals, communities, the next generation. So I love all of that, of what you shared. And before I toss things over to you, Sabine, I do want to just remind our attendees that if you have any questions, please be sure to tap that Q&A and to input any questions that you have for our lovely panelists today. Sabine, I'm going to toss it over to you. What do you see for the future of this work? And, you know, how do we really take things to the next level?
Sure. So for us, really, what I kind of see is innovation. So collaboration, but also innovation. So really challenging kind of the status quo that we've been in and getting creative, coming together, as has been mentioned, like leveraging technology. That's been a big thing. And kind of how do we use that to our advantage? Another thing to kind of touch on, though, is policy and advocacy, so that we really are creating that systems level change. Something that I kind of do hope to see for, and we're working on at the state level, is really looking at how do we get funding for improving nutrition security? How do we include payers, insurance companies in this work? Is there a way to be able to incorporate that as far as insurance and benefits? And so we're hoping to learn a lot about that in our food as medicine work, and really how do we create that cost effectiveness and the funding and appropriations needed to move this forward. And really, again, just kind of another thing that we're seeing is, as we're working on bridging that gap in the community and clinical space, is including nutrition and hunger as part of conversations and as part of medical training. That's been a big thing that, as we've been kind of within this space, it's not a standard to learn about this, kind of in many different disciplines and practices. And so how do we begin to make sure that that is a part of our training within the medical and clinical space, so that we can best merge, again, the two areas and be able to make long-term impact.
Absolutely. And again, couldn't agree more. And Uche, I do want to turn it over to you. You talked a lot about older adults and all the work that you all are doing at Meals on Wheels. And, through that lens, can you talk to me a little bit about the future of this work and how might we really take things to the next level?
Yeah, thank you. It's just wonderful to hear all that's been brought up already. I keep wanting to sort of raise my hand and say yes, yes, yes to all the comments, because it is exactly that kind of thinking that's going to get us to this future and the future is yesterday, right? The future we're talking about is here. We're trying to address it and meet the needs that are always persistent and evolving. I'm excited because coming out of COVID, which feels far away and yet present in so many ways, there's so much that we can take from that season of challenge to the nation and the world. And so many of us experienced the kind of isolation and limited access for nutrition and food that many older adults still continue to experience today. And that shared sense of challenge, I think, propelled so many of us to understand, how do we really break down silos and get to what's next and move into the future where we can have addressed these challenges before. Coming out of that season, some of the conversation I see in our nation has really shifted. We're talking about ageism in a way that we hadn't really talked about it before, as it surfaced during the COVID years. We're having national conversations around caregiving. I love to echo Sabine and Sakeenah's comments on food as medicine. That is definitely an area that we see in future will need continued investment and attention. The whole notion, Sabine, about healthcare delivery innovation. How do we continue to understand how we work across the continuum of care to provide services for older adults, for instance, that we share in different settings. In the healthcare setting, we're serving the same older adults as we're serving on our Meals on Wheels program. This is a community of service providers. And how do we work in a way that provides that kind of seamless support for these individuals? We're talking a lot about longevity and the boon and benefit that our longevity is providing our nation in terms of older adults who will outnumber young people in the coming years, and very, very, very soon. This is a big and broad population for which there's great potential and opportunity, but we want to capture that longevity benefit. How do we continue to invest in capacity where it's needed? That deep investment in the kitchens, for instance, in community-based organizations, so they can continue to do that good work, do it well into the future. And ultimately, a lot of the future lies sometimes in innovation, in new, and sometimes it lies in surfacing what's working at the community level. Lots of things work locally, and sometimes we don't know that because it's a big country. Lots of things happening in ma-pa sized community-based organizations or big and multi-million-dollar organizations. But how do we lift up what works, provide opportunities for scale and replication, so that we're really moving the ball forward in a way that's community-centered and powered by efficiency and effectiveness? So I'm very excited at these notions of the changes in our national conversation, the changes in the way we're seeking to invest and do work smarter, collaboratively, so that we can scale programming, build and grow partnerships that work, and ultimately leverage our collective influence in the halls of our Congress and our legislatures at the state and local level, as well as federally, to get this work done that we know is so needed and so powerful. Food is the cornerstone of health, we all agree, and it's so important that folks have access to the services and programs that they need.
And I know we just have a few minutes left, and I was kind of laughing, Uche, because you would think I know how to unmute my mic after COVID, coming out of COVID with all of our meetings. So thank you all so much for your patience today. But Sakeenah, if you can respond in about 20 seconds, there's a question that came in around, I teach university undergraduate students who are in the area of study around all the programs you've outlined. What do you hope that these students know about the topic as they enter their careers in a couple short years?
20 seconds. I hope that they feel like they can reach out to folks who work in this space to ask questions, to grab a virtual or in-person coffee, and that the field of research that we might be participating in, whether we're trying to better understand food insecurity or agriculture, local food systems, that there are so many questions that we still haven't answered, and that we need them to participate so that they can do that research, they can do that community building, whether it's an internship job or a thesis for an undergraduate major. There is still so much to learn and to answer in the space. We have not figured it all out yet. So please join us in the table. We need them for the future generations of work in this space. Please do reach out. That is an invitation.
Absolutely. And please reach out. And I just want to spend the next couple of seconds to thank you all so much for this critical, important conversation today. Thank you for all who attended our session. Please reach out, and thank you, thank you, thank you. Continue the work, continue the collaboration, come together, celebrate, build, move, make impact. Thank you all so much.